Uh, Today I'm going to be talking to you about doing business with the VA, specifically the Veterans Health Administration. Just a quick background on me. I am a veteran. I served 5 years on active duty with the Air Force. I've done contracting at pretty much every level, from operational base support level contracting to systems level contracting to contingency contracting in a combat zone. And now I am doing small business full-time with the VA. So a little bit different flavor, but I still work hand in hand with our contracting folks. So this is just a little bit of an overview of what we're going to be covering over the next few minutes. I'll talk about the small business program, talk about Public Law 109, which is also known as the Veterans Benefits Healthcare and Information Act, or Vets First. Talk about socioeconomic set-aside, specifically as they relate to veterans and veteran-owned small businesses, what VA small business advocates are and what we do within the VA, cover our top purchases annually, and then just give a little bit of a rundown on what our organization looks like and steps to doing business with us. And then I'll leave you with some useful resources, and then we'll do some Q&A if there are any. I usually like to open up with our mission, and that is to fulfill President Lincoln's promise to care for him who shall have borne the battle and for his widow and his orphan by serving and honoring the men and women who are America's veterans. Specifically, our mission in NCO 23 is buying for those who secured our freedom. I'm not going to read these to you directly, but I'm just going to kind of hit on some high points. So what is the VA Small Business Program designed to do? Our main objective is to provide maximum applicable opportunities in federal contracting to veteran-owned small businesses and small business owners. Some of the ways we do that are by removing barriers to agencies' abilities to meet those goals, which are set annually, to assist our internal customers and stakeholders, which are our acquisition professionals and our technical leads, on how to understand the policies concerning the small business program and how to utilize small businesses, and then providing necessary training to our internal stakeholders and professionals to provide a means of facilitating business involvement in the process. And that usually comes in the form of outreach and doing vendor days. We've been doing a lot of virtual vendor days, being that we're in the pandemic, but we're hoping to do some more in-person industry days coming up here soon. Why do we do this? Why do we have a small business program? Well, small businesses fuel our economy. They're the backbone of the economy. And if you look in the U.S. code, they're also the backbone of our national security. They tie directly into our national security and our industrial base. So it's kind of a twofold mission there. The VA is a potential customer for procurement-ready small businesses of any size. And people often ask, what is procurement readiness? Well, it refers to the ability of a small business to do these two things: participate in the federal government marketplace and to successfully perform on contract work. Just because you're a small business and you have something to offer doesn't necessarily mean you're going to be successful. You still have to prove that you are competent and that you are responsible, and that you can fulfill the terms and conditions of the contract as they are laid out. These are the different socioeconomic programs within the small business program. Obviously, what we're most concerned about at the VA are the first two, service disabled and veteran-owned small businesses. There's also the 8A program, which is a program where a business is directly contracts with the Small Business Administration and it's kind of a bootstrap program to help those small disadvantaged businesses get up and running. There's hub zones, woman-owned, and then just your average run-of-the-mill small business. So to be certified as an SDVOSB or a VOSB, you have to go through a separate process within the VA, which I'll touch on later. But the purpose is to provide federal contracting assistance to these veterans and to award contracts on the basis of competition, restricted or set aside for these veteran-owned businesses. And there needs to be a reasonable expectation that 2 or more SD or VOSBs will submit offers, and the offers are fair and reasonable. And how we usually determine that is through market research. We'll post notices out on our government point of entry, which is contract opportunities on beta.sam.gov. And vendors can respond to those expressing interest. And then if we find that we have enough interest, we can set those aside and we can evaluate those based on price reasonableness and other factors that are in the source selection criteria. So SDVOSBs are eligible to bid on VOSB set-asides, but VOSBs are not eligible. So VOSB is a larger category. It includes all veterans, whereas SDVOSBs is a smaller subset of the VOSB category. So that's an important distinction. So what is Public Law 109? So again, like I mentioned in the overview, that is the Veterans First Contracting Program, or what you might hear people refer to as Vets First. And that ensures legitimately owned and controlled veterans can compete for contracts within the VA. This is unique to the VA. It sets priorities for contracting preferences within the VA by placing SDVOSBs first. There is a separate certification process that only applies to the VA. If a veteran-owned small business wants to do business with any other federal agency, they just need to self-certify in SAM, which is the System for Award Management, when they create their profile. But if you want to do business with the VA, it's a separate, more in-depth process where you have to submit a lot of military documents and prove that you are, a majority owner in the company and that you make decisions on a day-to-day basis affecting that company. And like I said, other federal agencies allow veteran-owned small businesses to self-certify. This is done through the Center for Verification and Evaluation that falls under the VA's Office of Small and Disadvantaged Business Utilization, or OSDBU. They help veterans through the verification process and basically are advisors and liaisons to walk them through that. And then once you reach that, you receive your letter saying that you've been certified or verified, you will be listed on the vendor information pages, which is a separate site that acquisition professionals in the VA are required by federal law to check by NAICS code. That's a North American Industry Classification System, which if you've set up a business and you've met with your Procurement Technical Assistance Center, you will know what that is. If you haven't done that, that's your first stop. You want to get with your PTAC, and they actually have people at the PTACs that can help you along the CDE process. So talking about set-asides, again, like I said earlier, it's the policy of the government to provide maximum practicable opportunities in its acquisition to small businesses. Now, that doesn't mean that everything under 250,000 and above the micro purchase threshold, which is 10,000 for supplies, it's 2,500 for services, and 2,000 for construction. A lot of people will stop reading and say that anything between 10,000 and 250,000 is automatically reserved for small business, but it goes on to say, unless the contracting officer determines through their market research that there's not adequate competition or they're not going to receive a fair and reasonable price. So again, market research is where we make those determinations, and I can't foot stomp enough that if you want to do business with the VA or with any federal agency, you need to be responsive to those postings on contract opportunities, expressing your interest and making sure that they know that you're out there and that you are going to submit a bid if they do set it aside, or if they decide to restrict it to a smaller socioeconomic set aside. So you'll often hear the rule of two. The rule of two states that purchases shall be set aside for small business unless the contracting officer determines there's not a reasonable expectation of obtaining offers from two or more responsible small business concerns. And when we say responsible, you refer back to, procurement ready. Are you willing, able, and ready to do business with the government? Do you have valid past performance? Do you have the competency to fulfill the contract as it's laid out, within the time frame and the delivery windows and things of that nature. So again, as I mentioned earlier, these are the current thresholds. Those have been increased due to the COVID emergency. I don't know exactly what those are right now, but I believe it's 20,000 for supplies. I can't remember exactly for construction and services, but anybody at PTAC would be able to answer that question for you. And again, there are special procedures required to dissolve the small business set aside. That's usually where I come in as a small business liaison or specialist. You'll hear it called, or small business professional. Different agencies call it different things, but all requirement packages have to go through us if they're going to dissolve the small business set aside. And we review all those to make sure that small businesses are getting a fair opportunity. Again, requirements for set asides, there's the rule of two, or for federal supply schedules, which are like GSA, there needs to be three or more vendors that are willing and able to provide a quote or a bid. Again, the VA gives priority to the veteran-owned businesses under Public Law 109, and the CO has to be able to certify by the Federal Acquisition Regulation that there's the reasonable expectation of fair and reasonable pricing from responsible contractors. I know this is sounding redundant, but these are the things that often trip small businesses up when they don't understand why something wasn't set aside, or why they weren't awarded a contract. And these are usually what tripped them up. So that's why I'm kind of hitting on those multiple times. So if you look under FAR subpart 9.1 for responsible prospective contractors, the CO determines if contractors are responsible, and that they do that by looking at financial resources, ability to comply with delivery performance schedules, past performance, and things of that nature. And it depends on the complexity and the magnitude of the contract, how far they're going to look at responsibility. Obviously, the larger the contract, the more complex it is from a technical standpoint, the more they're going to look at this and look at certifications of people that are doing the services, and again, past performance that's recent and relevant, to make that determination. So talking about small business advocates, so I mentioned OSDBU earlier. Their job is to advocate for small businesses at a strategic level, at a higher level than what we do at the actual buying offices. So they make policy, and they work with the Small Business Administration to find ways to encourage and enable small businesses to better do business with the VA. They focus on bridging the gap between procurement ready businesses and contracting opportunities. Again, they are an outreach and education arm, so they provide guidance, information, and resources to both internal stakeholders and to small businesses who are looking to contract with the VA. They establish and monitor our annual small business goals. They function as an ombudsman for veterans who may be having issues with contracts or payment issues, and they participate in outreach events such as the National Veterans Small Business Engagement, which happens every year in the November-December timeframe. So if you're interested in attending that, They usually announce in the fall where that's going to be hosted, and that's a meet and greet opportunity for procurement decision makers within the VA to meet with industry on a national scale. And there are smaller events that are hosted at the actual medical centers throughout the year, and that's through the direct access program, which falls under OSDBU. So if you have questions about that, you can contact me, or you can contact anybody at OSDBU in the direct access program. And those rotate on an annual basis as to which medical centers are going to host those. Again, my level, small business liaisons, we're also advocates. We stay current on policies and guidance involving small business and federal acquisition that the Small Business Administration puts out. We measure contracting activities performance on goals and subcontracting as required by the director of OSDBU. We assist our staff, our contracting professionals on small business matters, and we participate in outreach events and help educate small businesses on doing business with the VA. These are some of the resources or sources that we use to do our market research to make the determination on whether or not we can do a set-aside system for award management. The SBA's Dynamic Small Business Search, and the Federal Procurement Data System, which is the central repository for all contract awards. So those are three places that we look, and we really look at the NAICS code, again, the North American Industry Classification System, or PSC, which is a product service code. We look at business names, agency names, and the best thing you can do to market yourself to the federal government and the VA is to make sure that your SAM profile is current, because that feeds into DSBS. That's going to tell what your capabilities are. Don't leave your capabilities narrative blank. Fill that out, because that's going to give people an idea. If they search a NAICS code, which is generic, they're going to get thousands of results, and it's very hard for somebody to go through thousands of results to make a determination. Whereas if your narrative has keywords in there that are specific to what it is that you do, it's a lot easier to find you, just like looking in the phone book. Again, we use the NAICS manual. The most recent one is from 2017, and then the PSC manual from 2015. Those are what classify the requirements and what those will be posted under. So when you set up a search agent in Beta SAM, you're probably going to want to do that based upon the NAICS code that is specific to your industry, and you can pick more than one, but I wouldn't pick hundreds, because then you're going to get notified of every opportunity out there, whether it's pertinent to your capabilities or not. These are the top purchases that the VA does annually. Obviously, they're all medical in nature, and then we do a lot of building construction and engineering services for new construction for medical centers and outpatient clinics. And then we also lease a lot of buildings for our CBOCs, which are our community-based outpatient clinics in more rural areas. This is just kind of an overview of who we are specifically in NCO 23. We're pretty large. We serve over 440,000 veterans in Iowa, Minnesota, Nebraska, North Dakota, South Dakota, and portions of those other states. We have 9 healthcare systems and 69 community-based outpatient clinics. Those are the major medical centers that we have within our territory. And we're just one VISN. There are 18 VISNs throughout the VA, so and every VISN does things a little bit differently. So this is our area here specifically. This is where I am, up in Minneapolis, St. Paul area. But each of these red stars is where a major medical center is. And then these are all of our CBOCs here, like I said, out in the rural areas. So steps to doing business with the VA. First, you're going to need a DUNS number. And again, your PTAC can help you with that. You're going to need to register in SAM. Again, if you're a veteran and you want to become eligible to take advantage of the Vets First Contracting Act, you're going to need to go through CVE to get verified and listed on the vendor information pages or VetBiz. Work with your PTAC to receive bid matches that are tailored to your capabilities. Develop an easy to navigate website to market yourself. Have a capability statement, which is basically your company's resume that says this is what we do, and it's easy for somebody to identify what your specialties are and how you can help meet a need that we have. And then again, FBO has just transitioned over to beta SAM, so that's beta.sam.gov. This should redirect you, but just in case it doesn't, it's now beta.sam.gov, not fbo.gov. And that's where we post all of our procurement opportunities over $25,000. And then these are just some of the resources that are going to help you in your quest to do business with the VA. Again, there's a lot of information out here on OSDBU's site, a lot of guidance. And again, if you are looking to market yourself to a specific medical center, or you have a new or innovative product or service, you can get with the direct access program at OSDBU, and you can sign up to actually present your product or service directly to the physicians and clinicians at those medical centers. PTAC, that's your first stop if you're new, you want to set up a business. There's also VBOX, Veteran Business Outreach Centers, where they will do boots to business type classes that will help veterans who are transitioning out of the military or who are just looking to start a business. And those are specifically tailored to veterans. They offer resources and training and education. There's the SBA. They offer assistance for small business loans and things of that nature, or if you just have questions about how do I become a small business, what are the steps that I take, they work hand in hand with PTACs. This is important here, and this is going to be transitioning over to the vendor information pages, or VIP, here soon. And that is our forecast of contracting opportunities. And that's where you can see what's coming up by quarter and by fiscal year, so that you can have an idea of future opportunities that are within the VA. Again, this is where we post current opportunities, beta.sam.gov, and those are over 25,000. GSA, that's our federal supply schedule. If you have supplies and or services and the VA buys these on a recurring basis, you might look at getting set up on FSS, because it's a lot easier for a contracting person to go on GSA than it is to post something on contracting opportunities. So that might be something you're interested in. You can find more information at this site here, fss.va.gov. And then there's more information on FSS contracts here. And then these are our National Acquisition Center, Strategic Acquisition Center. They award our national contracts and our strategic level contracts. Those are called indefinite delivery vehicles or contracts that anybody within any VISN can write an order against. So those are pre-competed. And then this is, again, VetBiz. That's where the forecasted contract opportunities are going to be in the future, and where all vendors who are CVE certified get listed. And that is all I have. Again, my name is David Derricks. This is my contact information and my phone number. So thank you for your attention, and feel free to reach out to me if you have any questions.
Thank you, David. I just have a quick question, and if it's too broad, don't worry about it, and you do not have to try and find an answer. But we do have the construction team from NCO 23 giving a presentation. And so I was just wondering if you, and so they'll be talking about, the construction side of opportunities coming up. Would you be able to at all, just mention or specify some of the medical supplies and services that the VA purchases, maybe most frequently or the largest purchases, just giving a little more information about the medical supplies and services side of VA purchasing.
Well, I forget which slide it was, but it was in the middle of the slide deck where I talked about, what we purchase regularly. So most often, we contract a lot for nursing homes. We spend, just in NCO 23, we spend about $90 million a year on nursing homes. We spend a lot on pharmaceuticals, and again, a lot of these are large businesses, so it's kind of hard to get into those markets if you're looking to start a small business. We buy a lot of medical supplies and equipments, things like patient lifts and hospital beds, and right now, obviously, with the pandemic, we're buying a lot of personal protective equipment. So gloves, masks, gowns, face shields. But as far as specialized medical surgical equipment, catheters, we're buying a lot of scope type equipment, and then all the service and maintenance that goes along with those things. So endoscopes, anything that you would find in a hospital, we pretty much buy that. So, and a lot of this stuff is on what we have, which are our medical surgical prime vendor contracts. These are pre-existing contracts that have been set up where, like I said, we can basically place orders against them. So they've been pre-competed. Those are for routine, recurring supply type items that we buy. But again, because of COVID, a lot of those aren't able to satisfy the needs. So we've had to go out on the open market to buy a lot of those things to just have in stock, in the event that there is another outbreak or a surge in the fall. People are talking about that, when everybody starts going indoors again, or, when people start going back to their offices, and then, if there's an uptick in COVID cases, they're going to need to have those things on hand. Does that kind of answer your question, or?
Yes, no, it does. And so if you're a small business, is there a place you see small businesses able to kind of best start their relationship with the VA if they wanted to sell medical services or products, or is getting on those schedules kind of the best avenue for?
Well, it all boils down to relationships, and business is no different. So it comes down to, when people, I hear this a lot from veteran-owned small businesses, they'll get their CVE certification, and then they'll contact me right away, and they'll say, "Hey, I got my certification, how do I get a contract?" Well, it's not that easy. You still have to be competitive. You still have to be responsible. You still have to be, like I said, you have to offer things at a fair and reasonable price. You have to have a good working relationship. People aren't going to want to do business with you if if you're not able to meet delivery schedules, or getting, I know I'm getting a little bit ahead, but this is, if you want to be successful, right, you start with the end in mind. So how can I set myself up to be successful by, making sure that my supply chain is running smoothly, that I'm able to meet delivery schedules, that I'm able to respond to the customer in a timely fashion, customer service, things of that nature. Those are all the bedrock of being a good business. So you got to have good customer service. You got to be able to understand, what you're signing up for, when you do win a contract, reading the fine print, what am I on the hook for here? What do I do if or who do I call if, things go wrong? Having that good relationship with the contracting officer on the other side of that contract is paramount. So I know that's kind of broad in nature, but the PTAC is really the best place to start. That's their bread and butter. That's what they do day in and day out is help train small businesses on how to market themselves and help search not just the federal marketplace, but anybody who's buying, and to see what's being purchased in your area. What if you're just looking to start a new business and you're like, where is there a need? PTAC can help you find that. Again, VA is going to be specific to medical, construction, things of that nature, but I get contacted by people all the time, and I just kind of have to tell them, look, we don't really buy what you're selling, but you can contact PTAC and they can help you maybe find other places that are buying the things that you're selling, because it all boils down to price and convenience. If you're selling something that anybody can sell, you're gonna have to compete on price and convenience, unless you have a patent or your product is unique in some way, and you can meet that requirement and nobody else can enter that marketplace. Again, you're going to be competing on price and convenience, or what offers the best value to the end user and to the government as a whole. So again, I know I kind of kept it a little bit at a 30,000 foot look, but if I get too specific, then it doesn't really help the general small business owner or somebody who's looking at starting a small business. So you really got to start with, okay, most of us want to be successful. How do I get there? PTAC can help you with that. And that's always what I tell people is your first stop. If you're just getting started, get with PTAC. It's free. Set up account, set up a one-on-one, or get in touch with a counselor, and they can help walk you through that.
Great, thank you, David. And so your information is on the screen. Are small businesses able to contact you with questions they had specifically about doing business with the VA?
They are. And again, the first thing I'm probably going to ask them is, send me your capability statement, and I'm going to be looking for whether or not they are procurement ready, because the last thing I want to do, is send their information to the contracting officer or to the end user, and then, find out that this business is, really not ready to do business yet. They're still kind of just getting started, because that's not going to help anybody. That's not going to help the business. That's not going to help the end user. And we have a separate process. It's actually been developed by one of my counterparts in Ohio, and it's a procurement ready screening assessment that he puts them through to see whether or not these businesses are ready to do business, because it's a disservice to the business and it's a disservice to the people doing the purchasing if they do all that market research and then they end up awarding a contract and they find out that business isn't really ready or able to fulfill that requirement. So yeah, they can contact me, but again, those are some of the questions I'm going to ask up front, just to make sure that you're ready to play ball.
Great. Yes. Thank you. So anyone watching this, hopefully you have spoken with your PTAC consultant. If not, now's a good time. Plug in here right now to, contact your PTAC consultant before the fall or the October event with us, where you can schedule one-on-one meetings, because you want to come to those meetings prepared. And David will not be able to attend on October 20th, but he is giving you his contact information right here. But again, please, contact him after you have prepared. So I think that is all I have. And thank you again, David, for taking the time.
Yeah, thank you, and best of luck to everybody out there. And thanks for your attention and your willingness to support our veterans.
All right. Have a great afternoon.
Thanks, you too.